Healthy India, I'm Lottie Alvik. Well friends, today we are going to be talking about a certain respiratory condition which is largely caused due to wrong lifestyles. If you have a faulty lifestyle, and especially if you smoke, then there are chances that you could suffer of COPD, which is actually chronic obstructive pulmonary disease. And once this disease sets in, there is no cure for it. You can only manage it and manage it intelligently. So to tell you more about COPD, I have in the studio three eminent doctors. It is my privilege to welcome Dr. Sunil M. Raheja, who's a physician in charge at the GB Pant Hospital, New Delhi. And sitting to his right is Dr. Balakrishnan Menon, who's an associate professor in respiratory medicine at the Patel Chest Hospital. And to my left is Dr. Usha Kiran, professor and head of the Department of Cardiac Anesthesia at the All India Institute of Medical Sciences. So I take this opportunity of welcoming three of you to the show. Well friends, right at the onset, let's take a look at this report which will tell us as to what COPD is, how it is caused and how it can be managed. Let's take a look.
Chronic obstructive pulmonary disease, or COPD, is one of the most common lung diseases. It makes it difficult to breathe. Two main forms of COPD are chronic bronchitis, which involves a long-term cough with mucus, and emphysema, which involves destruction of the lungs over time. Most people with COPD have a combination of both conditions. The leading cause of COPD is smoking. The more a person smokes, the more likely the chances of developing COPD. However, some people smoke for years and never get COPD. Breathing in second-hand smoke, air pollution and chemical fumes or dust from the environment or workplace also can contribute to it. In rare cases, non-smokers who lack a protein called alpha-1 antitrypsin can develop emphysema. The most common symptoms of COPD are cough, with or without mucus, fatigue, many respiratory infections, shortness of breath and wheezing. Because the symptoms of COPD develop slowly, some people may not know that they are sick. COPD has no cure yet. However, treatments and lifestyle changes can help you feel better, stay more active, and slow the progress of the disease. There are many things you can do to relieve symptoms and keep the disease from getting worse. Persons with COPD must stop smoking. This is the best way to slow down the lung damage.
Well, now I'll request Dr. Raheja to tell us as to what are the kind of figures, if I were to ask you as to what is the percentage of Indians, because I'm sure a large part of our country, especially women, must be susceptible to a condition like this.
Yes, you know, it's a global disease and more than 4 million people, they die of COPD every year. And out of this, more than 0.5 million, they are Indians. Okay. And it is the fourth commonest cause of death at present.
Okay.
And it is growing at the rate of 160% a year and going to be the third commonest cause of death by 2030. And also in the Southeast Asia, it kills more people than, you know, HIV, tuberculosis, malaria put together. Okay. And as far as India is concerned, there was a study done by Indian Council of Medical Research in which the figure was 3.29. And it was 4.2 in the males and 2.7 in the females population. And there are different studies done, you know. One study done in Chandigarh, Kanpur and Bangalore has put the data around 5%. Okay. And India being a developing country, the number of deaths because of COPD are 4 times more than the European countries and the USA. So you can imagine the burden of disease. It affects the quality of life, the efficiency of life, and overall mortality in the long run. And it's basically the disease which affects the entire family.
That's correct. So, Dr. Menon, do you think that the main cause for this could be also like lack of awareness? People probably do not realize that how serious can this condition get if they really don't take charge of their lifestyles.
Absolutely, you're absolutely right. Actually, a large amount of COPD develops because of smoking. It's something which is rampant, it's something which is increasing in our country, and even children are taking to smoking. Unfortunately, this disease develops after a very long time of smoking. Okay. So initially, the person doesn't realize what he's going to or she is going to develop over the long period of time. And this disease has been ignored to a great extent. Though it has been medical personnel were aware about it, the common people lump COPD along with asthma, because both of them have breathlessness. And it's only recently that more awareness is coming up on this, and the dangers of smoking is being highlighted.
That's right. And Dr. Usha, I'm sure in your body of work, you must have also realized that the moment a person takes up to smoking, he or she always thinks that, oh, I'm going to be very selective in smoking. And, you know, maybe I'll just be a social smoker and I'm sure I'll be able to have control over this. But as a doctor, what would you like to advise the people, especially who are still contemplating taking their first fag?
Yeah. Initially, they think like I'm a social smoker, that's right. But these are the things, because the number of chemicals in these things, especially the tobacco, is not single one. It may be more than 300. And these chemicals has got an addictive property. And because of that, it's not never once, it's always a desire to have more. And situation, the way the stress is increasing, the problems are increasing, there is always, once we start, there's no end to it. And most of the times, what we call it as pack years now. The packet taken every day, multiplied by the years, and when you start analyzing how many years we have been taking, started once as just as a social friendly manner with the pressure from the peers, but ultimately it's ended to such a dreaded disease. The social thing becomes totally antisocial.
That's right.
That's right. I think one should be very careful in starting all these things.
Right. So, Dr. Raheja, what are the forms of COPD? Are there specific forms of COPD? If you can just simplify it for us.
Basically, you know, it's a chronic obstructive pulmonary disease. It's also called the coronary chronic obstructive airway disease, chronic obstructive lung disease, and it has two forms basically, as we have seen earlier. It's one is the chronic bronchitis, in which there is a collection of mucus in the bronchi, airways, excessive secretion, spasm, and another form is emphysema, in which there is a dilatation of the alveoli. They are dilated.
Okay.
And most of the COPDs, these two conditions, they coexist. One may be predominant or the other, but both of these really affect the lung function. And as we have been talking about the smoking, smoking is a major cause of COPD. And any smoker is likely to develop, more than 50% of the smokers, they develop COPD in their lifespan. And beside this, in Indian setup, because you know in India more than 70% people still use the biomass, biomass as a fuel in the form of wood, coal, chullas, and you know that the residue of the crops, and you know that cake dung cakes, the animals, you know, that they make in the villages. And this is a major cause of COPD among the females in India, because they are using this fuel for the cooking purpose and indoor heating. And beside this, the other major causes are, you know, that you use that coil, mosquito coil. And you have to understand that one mosquito coil can release the smoke and particles equal to 100 cigarettes. And even in the cigarettes, people have to understand, you know, that the BDs are more harmful than cigarettes.
True.
Hookahs are more harmful than BDs, and that kilums are most harmful.
So, which means any form of smoke.
So it's a
which
myth
is
that BDs
inhaled,
are less harmful or hookahs are less harmful.
There is no
the
such thing.
people should take a message that hookahs and BDs, they are more harmful than cigarettes itself.
That's right.
So any kind of smoking, whether it is active or passive. Once we say active, the person who is smoking, and we say passive, the person who is sitting beside.
That's right.
Both are affected.
Right.
So it is dangerous.
So let me ask Dr. Menon that how serious can this passive smoking really get? You know, and I'm sure children are the most vulnerable in that case.
Quite right. It's the passive smoking spreads to those who are not actually smoking, the part of the families, the ladies, the children of the house. In the house, if somebody is smoking, there's always a smoke-filled atmosphere which would affect the children. And majority of this damage occurring to children would be because of passive smoking. So it's a very serious thing actually. And one more thing which I would like to highlight, it's not just smoking which causes COPD. A major change which has occurred over the past 10 years is that COPD has been identified as a disease. Previously it was a collection of some entities, as Dr. Raheja said, chronic bronchitis, emphysema. some pathological entities, some clinical entities. Now we have something called chronic obstructive pulmonary disease, which has been labeled as a inflammatory disease, which means that there is a reaction to smokes, to dusts, to other kinds of stimuli. This can include dusty atmospheres as encountered by miners who work. Chula smoke, as already Dr. Saab has told us about, so wood smoke or any other smoke, and of course air pollution as we see it, that is outdoor as well as indoor air pollution. So all these things contribute to production of COPD, and of course smoking is the most important of them, because we produce a lot of smoke. That's and true. Which are dangerous noxious gases and other such stimuli which may cause in children as a result of passive smoking.
So Dr. Usha, how does one go about recognizing these symptoms? Because I'm sure there have to be some telltale signs, and as a doctor, if you would like to tell these to the people, I'm sure they can just make themselves aware and know that, okay, this is the time for me now to seek medical help.
That's a good question. Basically, it starts with the cough.
Okay.
And very simply, in India, cough is very common.
Somebody and also is treated very commonly by people
very commonly.
Themselves.
They take a self-treatment for it, and they think, oh, it's because of the cold, and India has got lots of changes in weather. They take it just as simply cough. But most of the time, cough as well as some mucus, which we call it as a lot of sputum coming up, which they don't realize. They always blame it to the weather change or because of some irritant in the atmosphere, but that's the first sign.
Okay.
And it is said one should never ignore. India being full of tuberculosis, so usually they think it's tuberculosis, or it's mistaken also sometimes, but never. Once there's a cough and there's a sputum formation, and if it's consecutively for 3 months and for 2 years at least, that means it's going absolutely in the favor of chronic obstructive pulmonary disease. And one should never miss these kinds of coughs and sputum.
Right.
And
then, in addition to this, are there any other symptoms?
There's a breathlessness. They feel it. But this develops little later. One should not wait for the breathlessness to come. That's the time the disease is fully formed. It's taken its shape and inflammatory reaction. But initial stages, once there's a cough and it's not able to be treated by some whatever type of a medicine they take, whether the local house-made medicines or some Ayurvedic or some allopathic also, which they try to suppress it. And 3 months continuously with mucus forming, and that too for a consecutive 2 years, definitely one should not miss it. But breathlessness comes later on. But initially, this is the main symptom.
Right. So are there any other things that people should be aware of? Of course, these two are there, but is there anything else also? Are there any other changes that take place?
Yeah, basically, as Dr. Bala has already told, it's a systemic disease, inflammatory disease, and it affects, even the cardiovascular system also, and it can affect the bones also, can cause osteoporosis, and also it can induce, type 2 diabetes mellitus, and most of the patients of COPD have anxiety and depression associated
with it,
because it's a chronic disease. And it's a basically systemic inflammatory disease which can affect the whole body as such. And once we are talking of the causes, there are other occupational hazards also, like the people working in fertilizer industries, in silica, dust, cement industries, oil refineries.
So wherever there is any kind of pollution in the air, it
and
could
besides
be a
this,
reason
air
for
pollution increasing in the cities.
Oh yes.
That also is the major cause. And in India, even tuberculosis.
Well, Dr. Raheja, I'll have to interrupt you just for a moment, as it's time for us to slip into a very short break here. But people, when you come back, it will be time for you to pick up your phone and dial 1-800-115313 or 230-35420 if you have any question related to COPD. So don't go away, as we'll be back in just a moment.
बंटी और बबली पैदा हुए एक साथ, चलना सीखा एक साथ, कहानी सुनते एक साथ, सोते जागते एक साथ, तैयार होते एक साथ, और दोनों स्कूल भी जाते हैं साथ साथ।
शिक्षा के अधिकार के अंतर्गत लड़का लड़की एक समान, यानी सबको शिक्षा सबको ज्ञान।
कृषि शोध शिक्षा और प्रसार को गति देता, कृषि विकास की राह दिखाता, जनहितकारी, जन जन के साथ, ये है ICAR।
Free trade agreement for India and for Sri Lanka is between us. It came to effect in 2000. Since then, our trade has been exponentially increasing. Today, it has reached $5 billion.
Our future, although we've been heavily dependent on the United States for many years, our future is Asia Pacific. Our future will be China. Our future is India.
Trade remains minuscule, $4.5 billion a year.
Yeah.
And even if it becomes 300 folds by 2050, there's not really too much in volume terms.
Not when you have the two economies that are $1 trillion each. And this isn't meant as an excuse, but a lot of product that comes to India from Canada goes through third markets, so it doesn't get captured in the statistics.
From the people to the politics of every country, hear it from the ambassador's mouth in Globe Watch, Sunday 9 p.m. only on Lok Sabha television.
चड्डी लुंगी फ्रॉक पहनो निक्कर या पतलून साड़ी पहनो या सलवार चलो चले हम स्कूल पढ़ते लिखते मस्ती करते बन जाए हम कूल तो आओ चले स्कूल चले और बन ले थोड़ा कूल
There is an indefinable, mysterious power that pervades everything. I feel it, though I do not see it. It is this unseen power which makes itself felt and yet defies all proof, because it is so unlike all that I perceive through my senses. It transcends the senses, but it is possible to reason out the existence of God to a limited extent. Even in ordinary affairs, we know that people do not know who rules or why and how he rules. And yet they know that there is a power that certainly rules.
Welcome back. You're watching Healthy India, and today we are talking about COPD. So if you have a question related to this condition, this respiratory condition, it is your turn to pick up your phone and reach us at 1800115313 or 23035420. Remember, we are talking about COPD today. Now, Dr. Raheja, usually when any disease sets in, there are certain stages, and everything will begin usually very mildly and then go on to being very severe. So in the case of COPD, are there also these kind of stages?
Yeah, this is basically mild, moderate or severe. It may start as a slight cough in the beginning and the person may not be aware of it even. And even in the diagnostic criteria, we know spirometry can detect so many underlying cases of COPD.
Okay.
So there is a slight cough, shortness of breath may be there, and then the wheezing comes, and that the person in the next stage can develop the blueness of the tongue, nails. That is what we call cyanosis.
Okay.
And in this very severe form of the disease, the person may develop the altered sensorium, change in the consciousness levels, overall feeling very breathless, dyspneic, and that respiratory rate may be very high. So it's a very slow chronic progressive disease, and for that matter the patient, it is not just writing the prescription which is important to the patient. The most important for the physician is to understand the patient, to ask the questions, assess the patient, and then make a decision and give a plan to the patient. When you should take these medicines, when you have more symptoms, because it can become severe, acute exacerbation can be there, it can come down to normal, and it can increase because of some viral infection which is commonest cause, because of change of temperature, stress. So many factors are there. So once there is an increase in the symptoms, the person should understand when to go to the hospital. If they are feeling dizzy, breathless, short of breath, cyanosis,
so all those symptoms that we have been
fever,
talking about. Right.
They need to really consult a doctor immediately and maybe
So let me now
admit
ask you, Dr. Menon, that what are the battery of tests that you will usually run on a person to establish whether he or she is suffering of COPD at all?
Actually, COPD is a condition, it's easy to suspect on the basis of clinical findings. But to prove it, you need some tests, and the most important of this is spirometry.
Okay, now what does spirometry really mean?
It's a machine which tests your lung function. It's basically a lung function testing machine.
Okay.
And all the criteria as to diagnosis of the severity, the staging and the treatment is based on spirometry today.
Okay.
So, it is an equipment which may not be available throughout the country today, but to prove this disease you need this equipment. So, the stages of mild, moderate and severe are classified as per the lung function of the patient.
Correct.
So, the first thing what is required to diagnose this disease and to differentiate this from bronchial asthma, which is the most important step for us, is to take the patient up for a spirometry. Following this, other tests might be required like a chest X-ray, and of course, to look for complications you may need other things like cardiac evaluations and other kind of tests. But the spirometry is the gold standard and the baseline for the diagnosis of this disease.
Correct. Well, right now we are joined by Paresh Panchal from Gujarat. So, Mr. Paresh, if you are there with me, welcome to the show.
Good evening, all of you.
Yes, good evening to you. Mr. Paresh, please go ahead with your question.
हाँ, गुजरात साबरकांठा के साटम्बा से परेश पंचाल बोल रहा हूँ। मैं ये कहना चाहता हूँ कि जो वेपोरब आता है वो इनहेलर होता है, वो हमारे लंग्स को क्या नुकसान और क्या फायदा करता है? ज्यादातर लोग वेपोरब लगाते हैं इनहेलर से, अपने नाक में इनहेल करते हैं जो इनहेलर मिलते हैं बाजार में, वो क्या फायदा नुकसान करता है? दूसरी बात है कि जो दिवाली होती है, जब पटाखे जलाए जाते हैं तो उसका जो धुआं होता है वो भी मैं मानता हूँ ज्यादा लंग्स को नुकसान करते हैं। और जो सिगरेट के बारे में, टोबैको प्रोडक्ट के बारे में मैं इतना कहना चाहूंगा, सरकार को विनती भी करना चाहूंगा कि ये हेल्दी इंडिया बनाने के लिए हमें टोबैको पर बहुत ज्यादा सख्ती से प्रतिबंध लगाना है। सरकार ने एक कानून भी बनाया था पैसिव स्मोकिंग के लिए कि आप जाहिर स्थानों पर धूम्रपान नहीं कर सकते, वो कानून लागू है, फिर भी वो कानून का इम्प्लीमेंटेशन नहीं हो रहा है।
Correct. Thank you very much, Paresh ji, for joining us in this program, and let me try and get you the answers of all your questions that you've just asked, especially the first two. So, Dr. Raheja, would you want to tell him? He says कि वेपोरब लगाने से भी कुछ प्रॉब्लम हो सकती है।
You know, I think he meant inhalers. He said inhalers also.
No, he just said vaporub, and then he wants to know the damage that the crackers during Diwali can cause.
Diwali, you know, there is a lot of pollution, and there is an increase in the particulate matter and gases, sulfur dioxide, nitric oxide, carbon monoxide, you know. So, definitely during Diwali period, the patients of bronchial asthma for that matter, COPD patients, they have a difficult time. This can definitely increase their symptoms, and these patients should take precaution, like either they should stay indoor or they should go to a places where there is less of a pollution.
Correct.
And as far as, you know, these vaporubs and all these things are to be applied, we simply advise they just give, you know, very good feeling. Otherwise, they have lot of chemicals which can cause even allergy. So, the person has to really understand if he or she may be allergic to that particular, you know, content in the vaporub, whatever is. And even for asthmatic patient, as we have been talking, at times it is the patient is not aware whether he is having COPD or bronchial asthma. Even as a physician, we find it difficult on spirometry. Like we put the patient on spirometry and then we give that bronchodilator therapy and do the spirometry again, and then reassess whether it is reversible or not reversible. If it is reversible, we like to say it bronchial asthma, and if these changes are still there, then it goes in favor of COPD. So, everything needs to be assessed, and unnecessary use of these things should be avoided. And as far as inhalers are concerned, I think they are the treatment of choice, because the drugs are being used in micrograms.
Right. We will talk about the management of the disease, but before that, we have with us Shikha Kataria. So, Shikha, if you are there with me, welcome to Healthy India.
Yes, hi.
Yeah, please go ahead, Shikha.
Yeah, my question is that my mother was diagnosed with tuberculosis. She's 56 years old. Last year, she was diagnosed with TB. And the thing was that her nodules had gone big in size. So she had taken a medication for 6 months. And in fact, it was discovered because she had a normal cough and cold, and the cough was not going because of the nodules having grown in size. So the medication did take a toll on her, but she recovered from the disease. And a lot of those dye tests were done, you know, where the dye is put inside her body to check what is the size of the nodule, has it reduced. Now, the treatment being done and over with, Now whenever she coughs, we get little paranoid because it's not related with the cough, but we are scared that the cough is, if it doesn't go, that means the nodules have gone back inside. So in such a case, should we get the dye test done again? Should we, what do we do? It's just, we are so scared.
Even though we are talking about COPD and not about tuberculosis, but let me see if one of my doctors can take that question and if she should be tested for COPD at all. Yes, Dr. Mehta.
Actually, the condition isn't very clear from what Shikha said. Apparently, she had tuberculosis, and following which there were some nodules in the lung. And by the dye test, I presume it might be some kind of an imaging modality which has been carried out. So, of course, to assess the nodules, it might be necessary to undergo the tests, but if it is tuberculosis and if the treatment was taken properly, the nodule should have gone away, or if not gone away, at least been made inactive. And I'm sure she would need more tests. There's very little data to comment on this.
That's right. Well, so I think you need to take your mother again to the right doctor and get her condition assessed, Shikha. I think that's the advice to you. Now, Dr. Usha, now suppose if somebody comes and, this person is in, say, the mild stage of COPD. So in that scenario, how is this condition supposed to be managed?
Yeah, absolutely. Mild scenario, mild kind of a COPD should not be left. The very first thing they should be advised is quit smoking. That is the answer to many, many problems because it is triggered by smoking only. Supposing not a smoker, which is just in 10% of the people, rest 90% are because of the smoking habit only. But if non-smoker, then there must be some other triggering factor, which is usually pollution. And they are in that atmosphere or some occupational or some area or very rarely some allergic also. But whatever it is, it has to be properly managed. One thing is take an advice of a doctor. Never miss, never take it just a simple cough, and if required, get some bronchodilators. And depends on the symptoms, though it's mild, but it's initiated. So always try to take medicine. Don't neglect initial phase also. And answer is quit smoking and that area where there is a more of pollution, try to avoid that area. And another thing is take a better diet. Nutrition also is very important, and try to be managing in such a way, because India is having a lot of allergens, lot of pollutants. So try to take care of the respiratory system, good exercises, respiratory exercises, good walk, so that build up your pulmonary immunology also.
Correct. Well, I think that's a very good piece of advice there. And now we are joined by Mr. J.M. Rao from Mumbai. So, Mr. Rao, welcome to Healthy India. And what is it that you would like to ask?
Thank you. I would like to know that living in an environment, eco-friendly environment, can it avoid this illness? And controlled speech, that is, talking in a limited controlled tenor speech, can it avoid the illness? Thank you.
Well, Mr. Rao, I think you'll have to wait for a little while as it's time for us to slip into the second break of the program. When we come back, we'll definitely get the answer to your question. So don't go too far as we'll be back in just a moment.
Are you caught in a legal triangle? Do you need legal advice? For solutions to all your legal problems, watch
Do you take pride in being an Indian? Do you know what role you play in the making of India's democracy? Do you know who takes your voice to Parliament? Do you know it all starts with an MP elected by you? Know your MP and be a better informed Indian. Watch Know Your MP every Friday, 8:30 p.m.
रखते हैं आपके सरोकारों का ख्याल, उठाते हैं आपसे जुड़े मुद्दे, सुनते हैं सबका नजरिया, करते हैं बेबाकी से बात, आपकी आवाज, आपका मंच, देखिए हमारे साथ लोक मंच।
बंटी और बबली पैदा हुए एक साथ, चलना सीखा एक साथ, कहानी सुनते एक साथ, सोते जागते एक साथ, तैयार होते एक साथ, और दोनों स्कूल भी जाते हैं साथ साथ।
शिक्षा के अधिकार के अंतर्गत लड़का लड़की एक समान, यानी सबको शिक्षा सबको ज्ञान।
Welcome back. You're with me on Healthy India, and today we are talking about COPD. So if you still have a question that you would want an answer to regarding this respiratory condition, this is your time to reach us at 1800115313 and 23035420. When you call us, keep the volume of your TV set to the bare minimum so that we can hear you and you can hear all your answers. Having said that, we had with us before the break Mr. J.M. Rao, and he wanted to know that if one is in a totally pure kind of an environment, will one ever suffer of COPD? I think the answer is obvious, but still let the doctor say it.
Pollution-free environment is the best.
Yes.
And it's more of related to the pollution and lifestyle. Smoking is one of the major cause, as we have been talking, more than 85% cases. And healthy lifestyle like doing regular exercise, 45 minutes a day, walking, jogging, cycling, indoor, outdoor, whatever you want, sit-ups, yoga, deep breathing exercises. They are very helpful to increase your lung compliance and function. And healthy diet in the forms of a good amount of carbohydrate and proteins. They really and antioxidants in the form of broccoli, green leafy vegetables, gajar, fruits, pomegranates, for that matter any fruit, colorful fruit is rich in antioxidant like guava, grapes, whatever you want, and stress-free life. All these things play important role to increase your immunity, and this has definitely the prime role for preventing this disease. Why it is on the increase? Because of the lifestyle changes now. More people are
now
going to
let's see
smoking
what
and
our
other
next
issues.
viewer has to ask here, because this is Dr. Sanjay Sumani from Lucknow. So Dr. Sanjay, if you're there with me, what is your question?
Yeah, I'm 42 years of age, and I have bronchial asthma since the age of 21 years when I had my first attack. Now the thing is, during summers I'm reasonably okay, though I'm taking bronchodilators on a regular basis. In summers I'm reasonably okay. During winters I find a little congestion and I feel slight breathlessness. I got a spirometry also, which shows partial reversibility. I just wanted to inquire whether I'm suffering from COPD or in addition to bronchial asthma also. I'm not a smoker. Occasionally I chew tobacco.
All right. Well, thank you for all those details. And Dr. Menon, what would you like to advise him?
He was diagnosed as bronchial asthma at the age of 20, and he is not a non-smoker, and he showed partial reversibility on spirometry. All this points towards a diagnosis of bronchial asthma rather than one of COPD.
Okay.
But of course, COPD and bronchial asthma can coexist in a very small percentage of cases, but this is just an academic discussion.
Right.
Since he is a doctor, so I am putting it across. What's worse, some cases of asthma may not, or in future might develop a condition which is called chronic asthma with remodeling, which looks like COPD. So sometimes it becomes medically little difficult to distinguish these two. But from what he said, I am not very clear whether he is on inhaled corticosteroids or not, which is the mainstay of asthma treatment. He said he is on bronchodilators and he gets some problem in winters. But I think as management of asthma involves use of inhaled corticosteroids, and that is the first stage of doing so. He could of course get a repeat spirometry done and look for reversibility, but it's very unlikely that he's having COPD along with asthma. It's just asthma which has not been fully controlled.
Correct. Well, now we are joined by Mr. Jacob from Chennai. So, Mr. Jacob, if you're there with me, welcome to Healthy India.
Good evening, madam.
Yeah, please go ahead.
My question is, small child, like 5 years or 4 years, they are prescribed Corex medicine for respiratory failure. They are not advising to taking Corex medicine in the prescription. They are not giving pharmacy, the Corex medicine. Why this restriction? I would like to ask the question, doctor.
Mr. Jacob, I don't think it has really anything to do with the COPD, and I'm sorry that we just cannot discuss a particular medicine on this show. So maybe you'll have to actually go to a doctor yourself and probably try and find the answer to whether you should be given Corex at all or not. Now, Dr. Usha, now let's take up the second stage, which is the moderate stage. Now in this moderate stage, what are the symptoms that a person will have? And because sometimes in the mild stage, people may not realize and may not actually go to a doctor. So what is the management scheme which has to be applied during this stage?
Yeah, because moderate stage, that means disease has already formed, it's existing, and person started having breathlessness. They kind of feel they are having oxygen. Breathless means they are always feeling that they need more oxygen. They need more oxygen. And while walking and climbing, they feel they become breathless, and it's become difficult now for them, and they need an atmosphere where there's more of oxygen. So that's the time they should not miss, and they should come to real. Though we say that there's no cure of it, but it can be easily managed by the drugs.
That's right.
That's the time they should not miss it. They should go for a proper assessment. They should go for proper follow-up, not just once taken the medicine, forgotten about it forever. And people usually do it. They say, I don't have time to take medicine. And the moment they get some respiratory infection, which is very common, they are prone to, and then they'll again go for that medication. In between, never followed up, always missed it, and they're still into the same lifestyle. They have been advised. It's very easy to take a medicine, but very difficult to change a lifestyle.
That's true.
Unless there is an inner strong willpower to change it. And yeah.
Well, so Dr. Raheja, would you like to elaborate a little bit about this second stage?
The COPD disease, it may be moderate, it can go to severe form, and it can it is a very fluid situation. The person may be normal on medicine, that is long acting beta agonists, steroids and other form of medication, and he may develop severe form of the disease, what we call is the acute exacerbation of COPD.
Okay.
In the form of severe respiratory distress, shortness of breath, altered sensorium or delirious, and it can be because of some infections, viral, bacterial, or can be because of some stress factors, change of temperature.
Those
many things
really
can precipitate the attack.
Correct.
So this keeps changing. And that is why I told in the very beginning, the doctor has to really give a plan to the patient. It's not just writing the medicine and send.
And
You
also
have to
what
tell
she
the
said is that
patient-
the follow-up is very important.
Follow-up
in
is
this
very
case.
important. The patient should understand what kind of medicine the doctor has advised, when to take, how much to take. When the symptoms they increase, they have to increase the medicine. When to go to a hospital.
That's very important.
They have to understand. When to seek the immediate medical attention. They have
Well,
to
I'll
understand.
come back to you and find out as to when should a person go to the doctor in this case. But before that, we'll take in Mr. Jetli from Mumbai. So, Mr. Jetli, what is your question?
हाँ नमस्कार
जी
देखिए जो अपना महानगर के अंदर जो प्रदूषण होता है उसके कारण दिन भर काम करते हुए आदमी जाता है तो छाती में जैसे कि कुछ कफ या एलर्जी हो जाती है घर में जब रात को सोता है लेटता है तो उसकी सांस ऐसा दम घुटता है ऐसा कुछ उसको लगता है और जैसे जो बोला वेपोरो मतलब क्या हो गया कि जो अपनी बाम आती है विक्स वेपोरो या कोई और बाम आती है लगाता है तो उसकी छाती में से जब बैठता है तो कफ मुंह से खांसी के साथ बहुत ज्यादा निकलता है और यदि वो सब लोग के नींद में उसको ऐसा हो जाता है उसका दम घुट गया हार्ट एकदम से अटैक आ रहा है कुछ हो रहा है पसीना पसीना हो जाता है ये बीमारी क्या है और इसके बारे में क्या प्रिकॉशन इलाज है धन्यवाद
थैंक यू मिस्टर जेटली वेल ये COPD है कि नहीं हम जानने की कोशिश करते हैं डॉक्टर मेनन से
It looks like COPD.
Okay.
That's typically what happens in a polluted environment. And he goes and he has some breathlessness and a lot of sputum production. Actually, there are three main symptoms of COPD as has been told. It's cough, it's sputum production and breathlessness. But one thing which doesn't fit into his picture is he's having these problems only at night.
Correct.
The breathlessness of COPD normally presents when a person walks, when he works, when he exerts. Breathlessness at rest is more of a symptom of asthma. So he's either got asthma or he's got COPD. Or to complicate matters, it could be a cardiac point also, because he's having some chest pain and sweating and these kind of symptoms. So he definitely needs evaluation by a doctor, and it could be COPD, looking at the dusty environment in which he works.
Right, right. Well, okay, so I'm coming back to you, Dr. Raheja. Now you'll actually have to tell us as to when does a person really need to go to the hospital in this condition?
Yeah, you know, once a person is having, you know, this the cases of COPD, once they get acute attack in the form of, you know, breathlessness, shortness of breath, wheezing, that whistling sound coming out of chest, and there is a lot of change of, you know, alteration in this sensorium, and ghabrahat, and fever, or if the person is having any cardiac issues, cardiac problems, diabetes, elderly people 65 plus, you know, they have a less compliance, they should immediately go to a hospital for the treatment. And in the milder form, they can really, you know, take the nebulization therapy or the inhaler at home. And we have, you know, short acting drugs and long acting drugs. And whereas the long acting beta agonists are given for the maintenance therapy, and short acting are given in the form of nebulizer and, you know, that inhalers and respules. They
Well,
can
Dr. Raheja, I would like you to tell us a little bit about inhalers also and the right kind of usage of these inhalers. But before that, we have with us Gurdeep Singh from Chandigarh. So Gurdeep, if you're there with me, welcome to the show.
Yes, good evening, ma'am.
Yeah, please go ahead.
पहले डॉक्टर साहब ने ये बताया है कि एक जो मॉस्किटो कोयल है वो 100 सिगरेट के बराबर उसका लॉस होता है, नुकसान होता है, वो हार्म करती है। तो फिर मॉस्किटो से बचाव के लिए कौन सा डिवाइस यूज करनी चाहिए, या कौन सा और कोई आइंटमेंट और ऑयल यूज करना चाहिए जैसे कि मॉस्किटो के कटने से बचाव हो सके?
Gurdeep ji, I think you've just thrown a googly our way. So let's see if we can, if the doctors can handle it. Yes, Dr. Raheja.
I would like to say that, you know, the mosquito coils, they should not be used in a closed environment.
Correct.
First thing, if in the open environment, even that will be washed away with the wind. For the closed environment, there are so many smoke-free options, you know,
That's right.
in the form of electronic devices. I can't name the devices on this show.
Mosquito nets and what have you.
Mosquito nets, you know, there are creams.
And I remember you telling us about medicated mosquito nets these days.
Medicated mosquito nets can be used.
Yes.
So they are the better way.
Okay, well, so I think let's take on now from where we left. So I would like you to tell us as to how these inhalers should be used correctly.
Yeah, you know, the best form of therapy is the use of inhalers, because it's a myth that inhalers, you know, once you take, they make you dependent, they are more harmful.
Correct.
I would like to tell the viewers that they are the best form of therapy, because you are taking the drug in micrograms, and that too the drug is going and directly acting on the respiratory airways and lung. And it gives immediate relief, which will last from 6 hours to 24 hours depending on the type of inhaler or the drug you are using in that. There are short acting, there are long acting. And we have found that the commonest cause of, you know, the treatment failure in most of the patients is inappropriate use of the inhalers. Most of the patients, they don't know really how to take the inhalers. And that is why I was saying the doctors must, you know, advise the patient a plan. And for example, we have a inhaler like this. If it is kept for more than a week time, it should be test fired. It should be, you know, just shake it well and then test fire it first. And once you are sure that the medicine is coming out, then the person should hold it like this between thumb and the fingers. And you should just slowly exhale out air from your lungs.
Right.
Once all the air has been exhaled out, you should bring this inhaler between your teeth into the mouth and
just press.
No. Then you have to see that you start breathing from the sides.
Okay.
Slowly start breathing in. And once you have started the breathing process, then you have to give a first dose. Immediately you release it, and you keep breathing deep inside. And then you hold this breath for 10 seconds or more or less, whichever is comfortable to you. And then it is slowly released. And after using one dose, if you have to take the second dose, you should wait for another minute. In case there is a, you know, leakage of mist from the sides of the mouth or from the top of this inhaler, you should repeat it, because then the appropriate medicine may not have gone inside. And after taking the inhaler, it is very important that you maintain a proper oral hygiene by rinsing your mouth, because the inhalers which contain steroids can cause hoarseness of voice, infection in the mouth, fungal infections they can cause. And the maintenance of these, you know, very important. They should be cleaned once in a week. This is the body of the inhaler which should be separated out. Every week you should put in the warm water, and this container should not be heated because it is pressurized.
Correct.
Okay. Once you keep it in the warm water, just take it out, rinse it with the clean water, then shake dry, shake it and keep it dry, and then put it back.
Right.
So,
well, I'm so glad that you've mentioned all those important points. But right now, we are joined by Jitendra Kapoor from Delhi. So, Mr. Kapoor, if you are still there with me, welcome to the show.
Thank you.
Yeah, please go ahead.
Hello.
Yes, Mr. Kapoor, I can hear you.
Good evening, doctor. Good evening.
Yeah, good evening to you. Please go ahead.
Beta, I was having an asthmatic problem.
Yes.
The doctor has diagnosed me as sarcoidosis patient.
Okay.
So I just wanted to know the future course of action and advice from the experts.
Okay, thank you very much for your question. And Dr. Menon, आप उनको कुछ बताना चाहेंगे?
Sarcoidosis is a totally different disease. It's not COPD.
All right.
It's an immune disease, and it has a different course of action. It's not really COPD. If
All
you want
right.
me
So,
to
well,
comment.
then we can probably take this question when sometime we are discussing his condition. Well, I think it's just appropriate time for us to slip into another break, but do come back quickly, as now we'll tell you as to how severe can this disease get and what is the treatment required in that stage. So, don't go away, as we'll be back very quickly.
There is an indefinable, mysterious power that pervades everything. I feel it, though I do not see it. It is this unseen power which makes itself felt and yet defies all proof, because it is so unlike all that I perceive through my senses. It transcends the senses, but it is possible to reason out the existence of God to a limited extent. Even in ordinary affairs, we know that people do not know who rules or why and how he rules. And yet they know that there is a power that certainly rules.
चड्डी लुंगी फ्रॉक पहनो निक्कर या पतलून साड़ी पहनो या सलवार चलो चले हम स्कूल पढ़ते लिखते मस्ती करते बन जाए हम कूल तो आओ चले स्कूल चले और बन ले थोड़ा कूल
Welcome back. You're watching Healthy India, and today we are talking about COPD. So if you still have a question that's lurking somewhere in your mind, please pick up your phone and dial 1800115313 and 23035420. Well, as I promised you that we'll be telling you now about the severe condition of COPD and how that can be managed. So I'll request you, Dr. Menon, to tell us a little bit as to what does this severe condition really look like to a common man.
Okay, the severe condition of COPD usually would mean that the patient is very severely breathless. He's cyanosed, that means there's bluishness of the hands, and there are some blood criteria which have to be tested out in the hospital, where the blood oxygenation level falls below 60 and probably the carbon dioxide levels go up. So this involves admission into a hospital, maybe into an intensive care unit.
Correct.
And a variety of drugs have to be used in such a case. A majority of such patients would be on inhaled long-acting bronchodilators, what we call LABAs, along with some anticholinergics. And apart from that, a number of other measures, including oxygenation, is very important because we have to give oxygen from outside.
Correct.
In the most severe of cases where the lungs are severely damaged, there are options of even using non-invasive ventilators, which is what would be used in the treatment of COPD. And the most severe, of course, would have to go on invasive ventilation, where they are admitted into an ICU for that reason.
Right. Now, Dr. Usha, talking of managing this disease, now in the market if you go, you do find, you know, air humidifiers and all that, and they say that these are very good for people who are suffering of COPD, as it, you know, helps to kind of clear the air and all that. So is that really required, or is it just a gimmick?
It's basically the disease of pollution or disease of the smoke. And in India, there is a pollution.
Correct.
In India, there is a lot of smoke because of our lifestyle, our cooking style, other things. So, and in India, another thing is the weather in between becomes very dry. Maybe that is the reason we are prone to getting infections. And once there are infections, that's the time it flares up. And that's the time a person realizes, like, I'm suffering. Otherwise, they are used to that kind of a compromise, pulmonary function. So, that's the reason many people, like in a house also say, if you are having infection, take steam. So, that means give a humid atmosphere. But it's not really a cure for it. It's a dry weather. That's why some of the people are advising, okay, take a humid kind of a humid oxygen or a kind of mist. Exactly, truly speaking, is the disease of the smoke, and better avoid that rather than taking. Yes, you can keep some oxygen if required, if that is also moderate to severe. But that oxygen should not be taken dry, it should be taken humidified, because dryness can again produce kind of inflammation inside.
All right. So what else should be done to manage this condition, Dr. Raheja?
You know, the management, basically there is a plan depending on the symptoms,
Stage.
mild, moderate or severe. If the patient is having severe COPD symptoms, as Dr. Menon told, go to the hospital, patients need admission, maybe, you know, what have we talked about, the patient needs oxygen, then long acting beta 2 agonists, anticholinergics, bronchodilators, and some IV medications also. And in the mild to moderate form, the person at home should be given a plan by the doctor, by the physician, that see, these are your symptoms, you have to understand when they are getting worse and when you have to seek the doctor's advice. And once you have this, they can just step up their bronchodilator therapy at home. They can do other better things in the form of avoiding that irritant or pollution in the environment, making them stress free. And preventive aspect of the disease is very, very important. If you are having a COPD, you should always take care that you have a proper pneumococcal vaccine once in a lifetime. You are taking influenza vaccine every year, which comes in the month of September, October with new strains. Because, you know, 50% of the acute exacerbations in COPD patients are because of the infections. And if we can take care of that, it will really give a good relief to the patient in the long run.
Correct. So finally, is there anything important that you would like to tell the people? Is there any message that you would like for the people who are suffering of COPD?
First and foremost, don't smoke. If you are smoking, quit smoking.
Quit it.
This is the most important message which should be carried out. If you have a problem of cough, expectoration and breathlessness, you must go to a doctor, get yourself evaluated, get a spirometry and get treatment. It may be COPD, but it can be other diseases also. Either way, they need treatment. If you have COPD, take your medications regularly as per as the doctors tell you, and as it has been highlighted, do exercise regularly, maintain a healthy lifestyle, have good nutrition, understand the disease, and you will be able to lead a pretty good life.
Decent life, right. So, Dr. Usha, what would be your piece of advice to the viewers today?
Yeah, another advice is, first thing, as Dr. Menon said, quit smoking, but another advice is, don't be a passive smoker also. Don't sit in front of person who is smoking. That will be a good answer to just prevent this kind of a condition where there is a pulmonary compromise.
Right. Yes, Dr. Raheja, if you want to add anything to it.
Prevention is the best way.
Yes.
And in the form of, you know, having a healthy lifestyle, quitting smoking, living in a good environment, doing regular exercise, good nutrition, good diet. But if you have COPD, don't lose heart.
Correct.
We have good forms of treatment, good plans, and you know, these patients, they have a good life if they are remain in contact with the physician, follow their plan, advice, and we have all sort of treatment from mild, moderate to severe COPD. So they should not lose heart. They should feel stress-free and live a healthy life.
Absolutely. Well, I think those were the golden words today. But before we go, I'd like you to see as to what all we have discussed so far, and you can just look at some pointers and you will know actually how to defeat this disease. If not completely, at least you'll be able to manage it.
Symptoms of COPD: cough with or without mucus, fatigue, many respiratory infections, shortness of breath that gets worse with mild activity, trouble catching one's breath, wheezing. Complications in COPD: irregular heartbeat, need for breathing machine and oxygen therapy, right-sided heart failure, pneumonia, pneumothorax, severe weight loss and malnutrition, thinning of the bones. Risk factors for COPD: cigarette smoking, second-hand smoke, chemical fumes, dust, air pollution. The goals of COPD treatment include quitting smoking, relieving your symptoms, slowing the progress of the disease, improving your exercise tolerance, preventing and treating complications, improving your overall health.
Well, those were some important points which you can keep in mind. And finally, I would like to tell you that do keep writing into us, and that keeps us encouraged, and we would want to do everything that you would want us to do on this show. So for that, you need to write to me on this address.
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com, and our toll-free number is 1800115314.
Well, we do wait for all your mails, so do keep writing into us. And now let me say thank you to all three of you for coming today and for discussing COPD. Well, I think people, as we keep saying, that prevention is better than cure. In the case of COPD, this is absolutely true. So if you are a smoker, quit it. If you haven't started, never do it. And also, passive smoking, as three of my doctors have been saying, is also equally responsible for somebody getting COPD. And how it can be managed is actually pretty simple. First, it has to be diagnosed correctly, it has to be assessed properly, and if there is a doubt, do seek a second opinion on this condition. And if you know that you are suffering of COPD, the follow-up of the treatment is very important. Take the plan that the doctor gives you. Don't give up on taking medicines midway. And of course, you have to alter your lifestyles. You have to have the right kind of nutrition, the exercise, and what have you. And of course, do try and keep stress-free, as these are some of the things, if you keep doing them, you will be able to manage COPD very well. Well, with that, it's a wrap-up of today's edition of Healthy India. I'll see you next week with something equally important and engaging. Till then, this is Lottie Alaric saying goodbye and take very good care of your health.
कानूनी उलझने, अनसुलझे सवालात, जाए तो जाए कहां? जवाब हमारे पास।
Do you take pride in being an Indian? Do you know what role you play in the making of India's democracy? Do you know who takes your voice to Parliament? Do you know it all starts with an MP elected by you? Know your MP and be a better informed Indian. Watch Know Your MP every Friday, 8:30 p.m.
There is an indefinable, mysterious power that pervades everything. I feel it, though I do not see it. It is this unseen power